Hey guys, welcome and thank you for joining us. You're watching Open Studio right here on Cape Town TV. My name is Danny Kambwe. Today's conversation is a very interesting one because we find ourselves in one of the most difficult time, not just in our country but in our world. And it's not only humans that are facing hard times, but animals as well. So to speak to us a little bit more about that is Marchelle, who's joining me in the studio today, who's from the Mdzananda Animal Clinic. Did I say that correctly?
You did great.
Thank you. So Marcel, firstly, welcome to the show.
Thank you. Thanks for having me.
You're welcome. For those that's watching today that do not know you, that's seeing you for the first time, can you just give us a brief bio about yourself, where you grew up and how you got involved in the organization?
So I work with the Mdzananda Animal Clinic, which is based in Khayelitsha,
Yeah.
and I'm born and bred in Cape Town. Always lived here, haven't gone very far.
Yeah.
And it's an interesting journey I was on getting at this organization. I've been there for 8 years now.
Yeah.
It very much started with me leaving varsity, where I did a management program, and actually starting up an NGO in the community of Lavender Hill.
Okay.
So I had that with a partner of mine,
Yeah.
and it got to a stage where I just saw so many animals in the community, and I felt this big pull to assist the animals as well, because they are quite completely dependent on us as humans. And I went through a difficult time growing up, and I actually was very ill for a long time. And I adopted a little puppy, and I call him my recovery puppy, because when I got him, I started getting better. And that's where I decided, it's time for me to get involved with the animals and help them as well.
Yeah, many people don't understand, how fulfilling it is because we find many rescue animals with people. Some people are blind people that work with dogs. I don't know if rescue is not the correct word. You call them
The guide dogs.
Yeah,
yes,
guide dogs.
yes.
There's some people even take them on airplanes with
Yes.
them. So how has your experience been? Like you mentioned, you felt better once you had a dog, and many people don't understand like that they don't have that understanding as to how can an animal make you feel better. So how was that experience like
It's,
for you?
something for me about animals is that they love you unconditionally. They don't tell you you have to be a specific way or you're not good enough or all those things that humans can tell you. And when I adopted this little puppy, he looked at me as if I was the most perfect person in the whole wide world. And that really helped me to have self-confidence and to live better and to go out into the world. You have to get up in the morning, you have to feed them, you have to walk them. So you've got responsibilities now. And that's what I've found with the majority and actually all of the animals at our clinic is that they absolutely adore humans, and being with an animal is giving you so much healing, but it's giving them healing too.
Yeah, if pure love for animals is what has brought you to do what you are doing right now, it's quite amazing because you mentioned you worked at Lavender Hill and now you're working at Khayelitsha. And those two places are not the very best of places to be. So just working in those communities with your experience so far, can you just tell us a little bit more about that?
It's an interesting experience.
Yeah.
I personally enjoy interacting with all different types of communities, and I enjoy engaging with people and understanding their cultures and things like that. I must say my family's not very happy with me. My family's forever telling me it's dangerous and I need to protect myself. And yes, for sure. But what would we do if everyone just runs away and no one's out there helping? So I think I've got a calling to be in these communities and assist animals and people. So I need to follow that calling and just stay as protected as I can,
Will you agree, or based on just seeing how things is happening around us, especially within the communities of Khayelitsha and Lavender Hill, where you get people is overcrowded and there's animals all over the show. There's mixed breeds and all the kind of stuff. And now we're in a pandemic. People are looking out for themselves. I have to eat first. There's lots of people that have lost employments, and now obviously we're going to have dogs on the streets and any other animal on the streets that is starving and stuff like that. Do you think because of the pandemic that this matter has grown so much, or has this always been a problem?
I think it has to an extent always been a problem, but interesting enough, we've seen two very different things happening.
Okay.
The first is that people are caring more for their animals.
Okay.
Some people are caring more for their animals. And I think that's because of lockdown and they were forced to be at home and spend time with their animals, where others are really affected by the financial circumstances.
Yeah.
So they do have to hand over their animals. So it's a bit of both.
So how does the process work when I come with my animal and I want to hand my animal over to you guys?
So firstly, we usually chat with the person to find out why they're needing to hand over their animal. Some people are devastated. They really want to keep their animal, and then we might be able to assist them by putting up a fence around their home so that the animal doesn't have to live on a chain, or assist with a food donation or various things like that. If they really can't look after the animal further, then the animal will be booked into our stray program, a homeless program. There we will make sure that it's sterilized, all its medicals are good so that he's healthy, and from there we start promoting him to find a new home for them.
Okay. All right, so you don't just store them, you
No,
fix
we
them up
always
and then give them to a family that's going to be able to look after them.
Exactly.
Wow, that's amazing, and I can imagine it's lots of work.
It is, but it's very rewarding when you see this beautiful little soul with the new family and how happy they are. It's very rewarding.
Yeah. So within your position, within the organization as the marketing and communication, what are your challenges? Like right now, what are your challenges?
Well, as part of that, I do all our fundraising. So our budget is quite huge, as you can imagine. We see about 1,000 animals a month. So it's a lot of animals. So definitely now, as people are struggling financially, fundraising and donations is a challenge. And then I think it's also something that I see a lot is the intolerance that people can have with other people. So they might see that a dog has been handed over and lots of judgment and comments happen, especially on social media, because you can sit behind that screen and say nasty things, but you wouldn't say that if you were in front of someone. And not being willing to step into someone else's shoes. So that's an encouragement for people to look a bit into other things as well.
Wow, I mean, like what you mentioned now, cyberbullying is quite a problem. And I mean, if I have an animal, I wouldn't take my animal if I know I'm going to be judged. But we're going to take a short break quickly, Marcelle. When we come back, we're going to speak about everything that's got to do with the organization and what you're currently doing in the community. So for those that's watching at home, I urge you to not go anywhere. We'll be back after this. All right, guys, welcome back. I've got Marcelle with me from Mdzananda Animal Clinic, and she is the fundraising and communication manager. Yeah, I must just make sure I get that right. So we're here to speak about everything that's got to do with animal shelter and care. Like we mentioned earlier on, a lot has been happening within our societies, community, our country, our world, and our animals most of the time are the ones that are affected the most. So we're just going to speak a little bit more about that and what Mdzananda. Oh my goodness.
That's good.
I'm trying. What they are doing, to assist within the community, especially the community of Khayelitsha. So once again, welcome to the show, Marcelle.
Thank you.
You're welcome. So, just to continue with our conversation, you say that you guys are currently based in Khayelitsha, which is quite populated. There's lots of animals. You said you see about 1,000 animals a month. So how do you handle? Do you ever got into a position where you do not have space to care for these animals?
It can sometimes become really, really full. Luckily, we always are able to expand our capacity. So we've never had to show people away in terms of our animal hospital, because the pets in the hospital can come in one day and they might be ready to go home in 3 days' time. So the turnover in the hospital is quite quick. Some can stay up to 3 months. It really just depends on the injury. The small homeless stray section is not as big. We have quite limited facility there. And when we do reach a point where it's getting to capacity, we try and reach out to people from the public to open their homes as foster homes. So the pets can then stay there until we can find them a new home.
So how is that for you guys? Do you find it difficult to find a home for the pets, that's under your care? Or is that a quick thing that comes about?
It very much depends on the pet. People really like the cute little fluffy ones, but the normal brown street dog is not as popular. So the majority of Khayelitsha's dogs are what you would call the normal brown one.
Yeah.
And they take much longer to home, unfortunately. But it really just depends on the personality and the pet. Yeah.
Yeah. So tell me about the financial situation within the organization, because for so many animals, there has to be proper care. And
Absolutely.
how is the organization currently managing in terms of funds?
It's quite significant, as you mentioned. I've been there for 8 years now, and the budget has gone up exactly 800%. So each year it went up by 100% in the 8 years that I've been there. So we're looking at big numbers. Just the medication alone is nearly 200,000 a month.
Man.
So it's huge. But we have to continuously expand on the ways that we fundraise. So one of the strategies is to have a lot of people, just people from the public who can donate 50 Rand, 20 Rand, 100 Rand a month, whatever they're able to, and trying to grow that database of people. So for example, 150 Rand will sponsor a pet's vaccination, which means that they won't have deadly illnesses. And then we also approach some funds, trust funds, people who are overseas and might have funds specifically available for animals, events. We're continuously expanding and trying new things. So.
Wow. So when you guys offer service to the public, is it at free of charge, or is it a type of fee that's expected from you?
So we do charge a small fee. For a consultation, we charge 100 Rand, which will include all the vaccinations, dewormers, basic stuff. And then if your pet needs to go into hospital or for a surgery, it will be 150. So excluding the 100 Rand, it's just 150 then. So that is very small fees. Sometimes the operations cost us up to 6,000 Rand. So it's highly subsidized and very much relies on fundraising. But what we find is our reasoning for asking a small fee is that it encourages people to understand that animals are not just an object, that it has a responsibility attached to it. So otherwise people can just take more and more and more animals, which might not be good for them or for the pet owner.
I think it's actually a good idea, even though you're not charging them that much, but you are still charging something, and it's not because you want to make money from it, but because it's a teachable moment, that you have to be responsible to look after your pet. Otherwise, you're gonna pay, to get them the medication and the health care that they need. So currently, is the organization only in Khayelitsha, or are you guys looking to expand, or are you in any other areas?
We're currently just in Khayelitsha. If you think of Khayelitsha, it's enormous. So we've made a calculation that we estimate there's around 250,000 animals there. So we're only getting to 1,000 a month, So we still have a long way to go to reach all of them. And of course, you don't just treat them once. They continuously need assistance. Our one day when we're big dream is to be able to build a proper facility, because we're currently running out of various structures and shipping containers and things that have just been added as the facility grew. And so that we can increase that capacity with the bigger premises and building.
Wow. And you've been working in this place for quite a long time. You mentioned 8 years?
I've been there for 8 years, but the clinic has been there for 25 years
25
now.
25 years?
Yes,
Wow. You guys have been doing amazing work.
Thank you.
Tell me about the founder. Do you know any?
Yes, it's a phenomenal story.
Okay,
So the founder is Mr. Joe. And Mr. Joe is from the local Khayelitsha community. And he literally just looked around him and saw that his neighbors and community didn't know always how to look after the animals. So he took a shopping trolley and he went door to door, just bathing and feeding animals and talking to people about this. And people heard about this and then initially donated a bath. So he became a bathing clinic where he dipped them against fleas and ticks on a Saturday. And then got a shipping container donated where veterinarians came and gave their time on a Saturday. And it just expanded like that into this hospital that we have today, a big facility.
Wow. And I mean, you're still doing amazing work. You're still improving.
Yes,
you're
every day.
To get much, much bigger than what you are right now.
Absolutely, yeah.
Wow, that is an amazing story. It's an amazing story. So I mean, Khayelitsha, like we mentioned, is one of the places where much work needs to be done in all areas, and the youth within that community, many of them are trying, but because of lack of resources, it does get difficult, and just reaching out to animals already is a sign of change. So we are well in our way, and thanks to people like you and your organization. So we're going to take another break, Marcel. When we come back, we're going to continue and chat a little bit more about, how we can get into the organization to assist if that's the case, or even just to come and take an animal. All right, so for those that's watching at home, guys, do not go anywhere. We'll be back after this. Stay tuned. Hey guys, welcome back. I've got myself with me in studio from Mdzananda Animal Clinic. Yeah, finally.
You got it. I love it.
Yes, guys, we'll be speaking about everything that's got to do with animals, shelter, and care. And yeah, it's been amazing chatting to you today, Marcel. Really, I'm amazed to hear. We hear lots of stories, but not many have really gone so far to help animals. And the other day I was watching a YouTube video and I saw this guy. He's a soldier, and he came back from war. And the love with him and his dog, it was just amazing. And I mean, his family was there, but they gave him the space with his dog just to have that moment. And I mean, I'm sure you've come across many of those moments.
Yeah, it's beautiful. Just the way that, specifically some of our hospital patients, we've had hospital patients that just aren't getting better. And then we ask the owners to come and they start visiting, and the dog just changes like this. Just to have that love and support from the owner, it's wonderful.
Wow, and they appreciate it so much more. What animal do you have?
I have 2 little dogs. Yeah. Absolute monsters. So the one is a cross of a Jack Russell and something, and the other one's a cross of a collie and something. But they are my shadows. They go wherever I go.
Wow. I wish we had them in studio today.
I know. I should have brought them along.
Wow. So, you mentioned a lot of good works that your organization is doing now. So we're just thinking, looking into the future. You spoke about responsibility which you're putting into place for pet owners specifically, and wanting to expand and so forth. And also when it comes to finances, what will you want to see differently as a fundraising and communication manager?
Yeah, I think what would be great is if we weren't continuously struggling for finances, obviously. And I think that's every organization's big dream, that the finances were just readily there. And I think what would be wonderful is if we reach a point where we've been able to do enough education programs with community members that there's a reduction in the neglect. Because what we do see is that it's 90% of the cases, it's not physical abuse that's been done on purpose. It's unfortunate neglect that's happened because of ignorance, that people may not know how much food the animal needs or what conditions it needs. So having an educated community that really respects animals and as a community looks after the animals is great. That's what we hope for.
But do you think we are doing enough, as media, as the government, doing enough to educate our people, in terms of animal care? Because I remember a couple of years ago, if not last year, last year was the coronavirus, but it was more, so we didn't really have much festivity happening last year. But the year before, we spoke about the firelighters, and how much it affects animals. And for me, from my area of residence, it's not like it affected many people, like they didn't care. And we saw like fireworks going up and stuff. Do you think we are doing enough to educate people, the dangers and harm that we can bring to animals?
It's a difficult thing because, of course, with government, it's not something they can invest in. They need to look after the people first. So it is very much reliant on us as NGOs to do that education. And there's not enough of us. Even though there's a lot, there's not enough of us. The one thing that we would really love for government to implement is a law that animals need to be sterilized, because the population of animals is shooting up astronomically, and there's not enough homes for them, which is causing a lot of the neglect. So that's something we would love government to implement. And I think with that, there'd be a lot of education involved in explaining to people why that needs to happen, and all the different things that lead off from that.
Yeah, I think that's very important, because that sterilization process, or that conversation, not many people are really taking it well.
Yeah.
Because they're thinking you're harming the dog and stuff. So do you know what are the benefits, so to speak, that it brings, besides the fact that it does not, it helps with the reproduction?
Of course. So the definitely the reproduction is the biggest one. But there's many medical benefits, very like cancers that can happen, testicular cancer, breast cancer, that type of thing definitely happens in an animal and can cause death, which is a prevention then. And there's behavioral stuff that can change. A lot of male dogs who haven't been sterilized want to go around and look for mates, and they would jump over walls, they will climb under fences, they'll cause damage to properties. Not more, just damage that they cause. And unfortunately, often when they are going in and damaging other people's properties, people may act badly to them. We've had cases where boiling water is thrown on them or that type of stuff. So having them sterilized will not cause them to act out in that way. And also with very, very aggressive animals, it helps them to, they're still going to protect you, but it helps them to just tone down a little bit. Unfortunately, many people say, oh, but I want my dog to be aggressive. I want them to protect me. And they definitely still will, because animals have that loyalty to their humans. But it just takes that edge of snapping at anything that they see just down a little bit.
Wow. So that's some good education, where many people need to hear this, and that it's not a death sentence that you're sending your dog to. It's actually trying to help, because what I see is once a dog has given puppies, it's just left there. You give this one to this one. Not everyone can look after dogs thoroughly, like you guys would have done. So for those that's watching at home right now, that want to come to organization, maybe looking for an animal that they would like to adopt, which is help with fundings, how can they do so?
Well, I think the nicest and easiest way is to pop onto our social media. We're very active on Facebook. So just type in Mdzananda Animal Clinic, and you'll see pets up for adoption, stories of our patients, all of that. Otherwise, our website is also just www.mdzananda.co.za. And then you're also welcome to pop us an email at info@mdzananda.co.za.
All right. And there you have it, guys. So when I come to your organization, is there a process, or
yes,
how does it work?
If you want to adopt, absolutely. What we do is we'll have a conversation with you. This is just to establish what type of home you have, to make sure that the right pet goes to the right home. And then what we do is a small home inspection, which just makes sure that there aren't any holes and things that they can climb out or get sore, or that there might be people who are scared of animals in the home. So to make sure it's the right fit. And then there is an adoption fee, which is 600 Rand. The adoption fee covers the sterilization, all medical treatment, the vaccines, the dewormers. That alone would cost you about 2,500 at a normal vet. So that is included as well.
All right. Wow. Thanks a lot for that information, Marcelle. I hope those that's watching at home, you got just enough information to go out there and pick a dog at Mdzananda Animal Clinic, all the way out in Khayelitsha. So, Marcelle, thank you so much for coming to the show and speaking to us today.
No, thank you.
Unfortunately, come to the end of today's episode. Thank you, guys, for those that's watching at home. It's been an amazing journey. Until next time, bye-bye.